Hello! Hi, this is Dr. Allred from Allred Dental, and this is your weekly dose of Allred education. Coming to you here at Allred Dental. Today we're going to be talking about something that's really important when it comes to straightening your teeth and aligning them up so you have that perfect smile that you always wanted. This is called an aligner, clear aligner tray. It's clear braces. It's better known to a lot of people as Invisalign, but there's a lot of other companies out there that actually produce the same thing. Here at Allred Dental, we make our own. We call them Allred Smile Aligners. So a couple things I want to go over today about these. The first thing is, how do they work? How do they actually move teeth? So when you come into us and we start a treatment together, we're going to tell you that you have to wear these for 22 hours a day, which sounds like an insane amount of time to wear them, because it is. But we have to treat them like braces. And I'm going to use this flip chart here from ClearCorrect to explain why that has to be. So right here, it talks about when we put pressure on a tooth and we start to move it, it puts pressure on the bone on the side where we want to move the tooth, so to create that smile. And when it puts that pressure on the bone there, it starts and it activates these things called osteoclasts. So osteoclasts are what break down bone, actually move the bone out of the way so your tooth can move through the bone into the right position. So if you look down here, it says the breakdown of the bone, it takes about 48 to 72 hours to fully get going. So it takes 2 to 3 days before the bone actually starts moving out of the way. So we continue to put pressure, and then we call osteoblast, it actually fills in behind. This is why you have to wear retainers for 3 months while it holds it in place, while the bone builds up and kind of cements the roots in place with your new smile. So this next flip, if pressure is removed from the teeth for 4 hours, osteoclastic activity stops. So that's why we say 22 hours, because if the pressure on the tooth is off for 4 hours, it takes 48 to 72 hours for it to start going again. So if you leave them out longer than 4 hours in the day, it's going to take 2 to 3 days to get the teeth moving again. So that's why it's so important to wear them 22 hours a day is the goal. You just take them out to eat, brush, rinse out if you're out at lunch, and put them back in. So that's important for you to get your smile. I know there's a lot of companies out there saying you can just wear them at night. That is not true. That is a lie, because our physiology says we have to have the bone move, and that takes time. The other thing I wanted to talk about is gross trays. So some people, they come in after a couple weeks with their new set, and their trays are just dingy, full of food, and they haven't spent any time cleaning them. Other patients come in, they have spent time cleaning them, but they're still a little gross. So I'm going to give you a little tip on how to brush these, how to get them really clean. It sounds weird again, but the best thing to use is dish soap. Dish soap or hand soap, antibacterial. You put them in, squirt it on your toothbrush, right? A little bit here, turn it on, and you just brush away until all that comes clean. And what you'll find out, you do this every day, these trays will stay pretty much as clean and clear as you have them here, keeping your smile beautiful while you're aligning everything and creating that ideal smile for you. This has been a couple tips from Dr. Allred and Allred Dental, and we're excited to see your aligners and your smile and help you reach that smile that you've always wanted. Have a good day.